Rehab on a Fractured Hip by Shania Colton, Tony Hampton, and India Turner. A hip fracture is a break in the upper quarter of the thigh near the hip joint. As shown in the picture, this hip fracture comes from a broken femoral neck. A little background information about the patient is she is a 69-year-old woman who fell down the stairs at her house. She has no prior injuries and she is slightly active in her everyday life. She enjoys going to bingo on Tuesdays with her friends and going fishing with her grandchildren. X-rays show that she has fractured her hip and will need to have surgery. After surgery, she will have to do rehabilitation for at least 6 months. PSA, which is the problem-solving approach, which is how you approach this rehab plan, rehab process, and how you decide what goals you're trying to reach by learning background information about the patient. And you do so by asking a few questions and analyzing them. So we asked, has she ever had any injuries before? No, she hadn't. Has she needed any surgery before? No. Does she have any health issues such as diabetes, blood pressure, or irregular heartbeat, or more? No. What phase of the healing process is she in? She's in the acute inflammatory phase right now, and that's just because she just had surgery. What are her short-term goals for the rehab process? Well, her short-term goal is to be able to weight bear completely and walk around with little to no pain. Her long-term goals is just to be able to get back outside and play around with her grandchildren a little bit and be able to start back fishing and going out on Tuesdays with her friends. As she determined her goals, we start to come up with a treatment plan and what best will fit her and get her back functional and able to return her everyday activities. And that's just based off her personal experience, research that we have done as a therapist, her preference of exercises, things she likes to do, things that she knows she's never been good at, limitations such as if she had a health issue, which she doesn't, and any impediments, which she does not have. The modalities and exercises being used will vary over the course of the rehabilitation process based on improvements or areas she needs more work in. The treatment plan will be based off of what best fits her and she is comfortable doing. She will be re-examined in about a month to see how she's improved. It will be determined if she has reached her short-term goal and she can make new goals or add on more if she has not reached those goals. The examination will determine the effectiveness of the modalities and exercise for her. She can also communicate if new problems have occurred since the rehabilitation process has. So, if she has another injury that has occurred, it's just best for her to go ahead and let us as a therapist know, so we can go ahead and fix that problem as well, and she can continue on with a progressive healing process. The immobilization and protection phase. The goal of this phase is to protect her from any further damage to the hip and make sure she is letting her hip properly heal. The rehabilitation process for her hip will start the following day after surgery to prevent effects of long-term bed rest. She is encouraged to sit in a chair, but she does not need to try to walk or put too much stress onto her hip. While she is laying around the house, she needs to rise to keep down the swelling and pain levels in her hip. The elevation of her body solely depends on what is comfortable for her. So during the immobilization phase, pretty much want to protect her and make sure she doesn't do more damage to her body. She allows it to heal the way it needs to. She doesn't need to be lifting up anything too heavy, like holding something heavy, and that bearing weight on her lower body too much. She does not want to lay around in the bed too much either because her hip can become stiff. So she wants to try to get up and move around. That will help her a lot. Flexibility, and range of motion. The goal of this phase is to make sure she has no stiffness when moving the hip joint. Some exercises she can do are some bedside leg lifts. She'll need to be in a comfortable lying position. She needs to move the affected leg back and forth slowly 3 to 5 times. Another exercise is to use a partner to do passive range of motion. This is when the therapist holds firmly above and below the hip joint and moves it around by flexing, extending, and abducting and adducting the hip. General strength. The goal of this phase is to gain strength not only in the hip joint, but the joints surrounding the hip joint as well. Some exercises that can be done are riding on a stationary bike for a period of time or swimming. These exercises are low impact exercises that won't cause too much stress on the joints. Other exercises that can be done to strengthen areas around the leg and to just work on stabilization of the leg to prevent future injuries of the hip and to just build more strength are things like lunges, calf raises, leg lifts with resistance bands, squats. These exercises will be in therapy when she's able to bear weight on the affected hip because you don't want to do that too early and cause damage. You want to be careful, and until she is comfortable doing it, she does not need to be doing it at home because she needs to know it's the proper way to do it. Do these exercises. So she needs to be under a physical therapist supervision until told otherwise. Functional activity. Physical activity is highly recommended in order to improve bone density, strength, and overall balance. Weight bearing exercises and other types of exercises will help the patient with fall prevention since 90% of hip fractures are caused by falling. For example, have the patient practice walking with obstacles and challenges in their path. This has been proven to help with the prevention of falling. And also we had other exercises we wanted to show, but since we can't show them in class, I will just name them and explain what they are. We had the wood chop exercise, and it can be done with a cable, resistance band, or even a weight plate. If using a cable or band, stand perpendicular to the fixture and turn at the torso, allowing hip rotation, then push away. And you want to be able to control the movement of the eccentric until you're complete. And then we have the Pallof press, which is anti-rotational exercise. It's using a cable or resistance band. It starts similar to the wood chop, but you hold the attachment at the torso, maintaining upright posture. Press the attachment away from your body until your arms are locked out in front of you, and then return. This completes one rep. Ensure you maintain an upright posture throughout, and do not allow the resistance to turn your body. So the whole time you want to maintain the proper posture because if you don't, that can cause injury. And you don't want to start off with too much weight. And the way we were gonna do it with her, since she's an older lady, we weren't gonna do it with any weights or anything. We were just gonna do it with the start off with the yellow resistance bands and then work our way up as she gains strength in her hip It was just pretty much to strengthen her hip back up so she can rotate, and then strengthen it so maybe if she falls again, it's less likely that she will be injured, maybe a little bruised, but not necessarily hurt herself to where she'll have surgery. But the main thing about physical therapy, we want to avoid her falling again. She can now return to play or activities. She will be able to return back to her normal activities that she enjoys, such as fishing with her grandchildren and playing a few games of bingo with her friends. We will send home exercises for her to continue to do at home, just to continue stabilizing her lower limbs and her back and things like that, so she can have a strong hip joint, and she won't be a part of the 90% that falls and break her hip again. She will be able to walk with the proper gait, because we will make sure she works on that before she leaves. And these are our references.